Thank you for tuning in to this episode of the Veterinary Cannabis Society Podcast. My name is Emily Stewart. I am the VCS's Development Manager. Today, I've had the good fortune of speaking with Dr. Sheila Dodson, owner of Mariposa Veterinary Wellness Center. Dr. Sheila is a distinguished clinician, researcher, and volunteer in the veterinary field. During this podcast, she details a fascinating study on hemp oil for arthritic dogs that she helped to write. She also discusses the importance of nutrition as part of integrative veterinary medicine. I left the podcast feeling personally inspired and very confident about using hemp products with my cats. The VCS hopes that you leave feeling the same way. So, Dr. Sheila Dodson, thank you so much for joining myself and the Veterinary Cannabis Society listeners today. Before we dive into the science, can you tell me a little bit about how you became a veterinarian?
So I'm actually one of these late in life career change people. I was in business for many years and decided my true passion was veterinary medicine. I think when I was fresh out of college, the first time I have a Bachelor of Fine Arts degree in art. So, you can't really mix art with science very easily, but I still had this passion and love for animals. And so decided that business was something that maybe wasn't fulfilling some of my needs. So I quit my business career and I went back to veterinary school and I graduated at 42. So I was a little bit older than everyone in my class, but I had such a good background of having a business background. I think it gave me an advantage over some of my classmates. So that's kind of how I got started.
That's absolutely incredible. I had no idea. And as a 36-year-old person who sometimes considers if I could go back to school to become a veterinarian or a nurse, that's inspiring.
I
Because
would say do it. I tell anyone who's thinking about that is, I think my brain cells weren't as quite as fresh as people younger than me, but I think I was smarter in how I learned. And so I would encourage anyone, I tell anyone that I talk to, it's never too late to decide what you really want to do in life. And so pursue your passion. And I think pursuing my passion is what got me through vet school, what got me on the career path that I'm on. And I couldn't be happier.
yeah, it's really impressive to know that you did start later in life. And I actually have your CV in front of me, and to go through all of the professional association leadership roles and memberships that you have, looking at everything from the veterinary state boards, Kansas Board of Veterinary Examiners, American Animal Hospital Association leader. You also started the Kansas State Animal Response Team. You're on multiple boards of directors. It's so impressive to me that you would have garnered all of those roles in a relatively short time.
Yeah, it's kind of interesting when I think about it because at one time I was on the board of directors of 5 different boards. And I think because when I came out of school, my passion was giving back to the community. And I will never forget one of my very first jobs in a clinic here in the Kansas City area. My fellow associate said to me, "How much are you getting paid to do all this?" And I said, "I'm not getting paid to do this." And I was appalled that he felt like that I shouldn't be doing unless I was getting paid. So I found my real passion in working with animal shelters and trying to improve quality of life for them and helping underserved people spay and neuter their pets. And so, yeah, when I look at it, I wonder, wow, how did I get all that done in such a short period of time? But I think because it was my passion drove me. And so I'm kind of one of these, if I believe in something, I'm going to give it my all.
Yeah, and in a way, you by starting late, I don't think you had the time to, become jaded. I think
True.
anyone who's been in a single field for a really, really, really long time and has seen its ebbs and flows can sometimes become jaded. And yeah, maybe you're forever in the honeymoon phase of
Yeah,
veterinary
exactly.
studies.
Well, actually, that's what convinced me to go ahead and go back to school at a later age is that I thought, I still have all of these years to practice before I retire, but yet I don't have 40 years to practice. So I'm not going to get to that point where I'm burnt out or overworked. So it was a fun way to do it.
Amazing. So, one of the things that you have also under your belt is you're a certified veterinary acupuncturist. That you, according to your CV, you got in 2011. So how long had you been practicing veterinary medicine until you got your acupuncture certification, and why did you decide to get that?
So I always had a passion for maybe alternative routes in veterinary medicine. I really believe it gives me one more tool in my toolbox. So I have a lot of things to reach for when conventional medicine doesn't give me the results I'm looking for. So I graduated in 99, and so I practiced conventional medicine for those good first 10, 11 years, and decided now that I understand medicine, I would want to have the option of expanding that. So it was easy for me then to focus on acupuncture. I do nutritional counseling. So I do a lot of alternatives in my current practice. There are four other veterinarians. Three of them do exotics. Three of us do acupuncture. One of us does herbal. One does chiropractic. So we have this nice blend of different modalities. And it gave me an opportunity to really explore that. Once I felt confident that I understood conventional medicine, then I could expand that. So I don't believe that there's only good and only bad in one modality or another. I believe that using the best of all of them gives you the best results.
That's fantastic. At the Veterinary Cannabis Society, we definitely support that ethos. So, cheers.
Yeah.
And with that said, how we first learned about you was through our sponsor, Standard Process. Can you tell me a little bit about your relationship to Standard Process?
Yes, I actually started using hemp oil in my patients back in about early 2016. And I had always been a supporter of the standard process supplements. So when they approached me, oh, it was probably like mid 2018, they decided to develop a hemp product. And so they approached me and said, hey, would you try this in your patients? So I said, sure, I was always open to that. And so I did kind of my own little mini trial with about 28 dogs. And we gave them the hemp oil, and I noticed such an improvement in them. 71% of the owners said that they saw noticeable improvement, and a third of them stopped their current pain meds. So I thought, wow, this is really, we're on to something here. I had never really focused on the outcome of how my patients responded to being on hemp oil. Several of them noted that their dog's OCD seemed to be decreased. Some of them had increased quality of sleep. And they were one dog, the owner was saying, she's thriving now. And I was actually considering euthanasia. And so now she's doing so well, I've changed my mind. So one comment, one owner had run when she ran out of the product that we had given her. She said she noticed she changed to another over-the-counter product and noticed that her pet began snapping at the other pets. So it was a change in quality of product, which kind of led me to believe that there is such a diverse difference of quality of products on the market. And I believe so much in the way Standard Process formulates and makes their product using just, organic, whole food ingredients. And so I approached them and I said, hey, let's do a research project? Because at that time, veterinarians were very reluctant to use hemp oil. There was a lot of misinformation out there. Veterinarians were not very well informed, and so they were afraid to use it. They thought, oh, it's illegal. I can't. I'll get in trouble with my state board. So there was a lot of roadblocks to getting that product in the hands of veterinarians who could really help their patients. So I felt that doing a research project more from a clinician perspective rather than a researcher perspective would give more credence to veterinarians in the field. So I'm not a researcher, but I am a clinician who sees the difference in my patients. So we work together to develop this research study. And so we actually enrolled 40 dogs on this study. And so we started them, it's a crossover. So they were on placebo and then they were also on the hemp product, and it was blinded. So nobody knew what they were on. They were 8 weeks on one and then 8 weeks on the other. So we started mixing. It was randomized. So some of them started on hemp, some of them started on the placebo. So we had such good results from that study and we actually did publish that. So that study was published in July 12th of 2024 in the Frontiers in Veterinary Science. So we were very happy to get that results published, and really based upon how dogs in a home environment respond. So we did things like, once again, I'm more of a hands-on, how do we tell how this is improving them? So we put FitBark accelerometers on each of the dogs. So that measures their activity. So a lot of times owners don't know how active is my dog while I'm at work or when I'm not home. So we wanted to see activity level. How active are they when they're actually on the hemp oil? We had the owners fill out a canine brief pain inventory, so they kind of track their perception of pain. They also filled out a weekly questionnaire where they kind of monitored activity, appetite, if there was any side effects. And then we measured their gait. We did a gait analysis so we could actually measure how they are moving. So we did that, at the beginning of each phase, the middle of each phase, and at the end of each phase so that we could see the improvement on those who were on hemp and how those responded when they went back on the placebo. So half the dogs that were on hemp first, we could kind of see what happened after they were off the hemp, how that impacted the results. And then we measured, of course, the blood panels. In veterinary medicine, there was this concern about the impact of hemp oil on liver enzymes. And so I felt, well, let's measure that. And as a side marker, we found no impact on liver enzymes of significance. I think some of the fear that veterinarians have about the impact on liver is a little bit unfounded, maybe, because most of the studies have shown a dosage of about 2 mg per kg twice daily doesn't have any impact on liver enzymes. So some of those studies that came out with liver impact are really on much higher doses. So I think it's dose dependent. But we also measured pro-inflammatory markers. So how is inflammation in the body? What are those levels? And then, of course, we measured their phytocannabinoid levels. So we found, interestingly enough, that after 8 weeks on the hemp oil, that 57% of them had decreased pain scores by the owner's assessment. On one part, 51%, and then 42% in the other group. And then when they went back on placebo, that first group, they had an increase of about 38.5% of pain again. So once they were off the hemp oil, we did appreciate that their pain levels started to increase again. On all of the pro-inflammatory markers, they were all decreased pretty significantly. So after being on the hemp, they were decreased anywhere from 32% to 56% on tumor necrosis factor alpha. And then we did the interleukin 6, and that was like about 33 to 34% decrease of those. And interleukin 8, about 35, 36% decrease. So we saw consistent decrease of those inflammatory markers once they were on the hemp oil. And interestingly enough, with the little FitBark accelerometer, we saw an increase in activity levels. So that's something that it's hard to measure, once again, because you have owner's perception, but we wanted owner's perception, but we also wanted to be able to back that up with what we actually saw in the data. And we did the first group, they had an 18% increase in activity after 8 weeks. The second group, after 8 weeks, they had a 35% activity and increase in activity. So it was significant enough that it just shows that they felt better, they were moving better. In the gait analysis, the lameness scores decreased when they started hemp anywhere from 8 to 10%. So we could actually measure how their gait, how they were walking. And then once they were on the placebo, the lameness actually increased anywhere from 7 to 16%. So we saw that nice decrease. So our data had some really significant, information on just the benefits of how hemp oil supports the endocannabinoid system.
Mm-hmm. That's incredible. How long overall did this study take for you to do the actual data gathering portion?
So we completed the study in 2022, the end of 2022. So it was a 16-week study. And so in order to compile the data, that's where standard process researchers stepped in because, as I said, I'm not a researcher. I'm really good at the concept and putting it together, and they were really good at pulling all the data together. So I think by the time, so that was 2022. And so by the time they submitted it, it was maybe within almost, I don't remember when they submitted it. I think maybe a year or so afterwards. So it does take some time, but I think it's just important information that I think everyone needs to be aware of.
Okay. Yeah, that is so incredible. I know a lot of organizations are interested in conducting some kind of study like this on their product. But, kind of what you've shown to me is this is a multi-year long process
Yeah.
that takes a huge team to achieve. And it's really incredible that you've done it. One thing that, is kind of playing in the back of my mind this whole time is it's so incredible that we saw these results from hemp. What do you think? How do you think the results would have been different if you were using something like CBD oil or a full spectrum oil, a broad spectrum oil? Do you have any thoughts on that?
So actually, the hemp oil that we use in the study is a full spectrum oil. So
Okay.
yeah, so there's a lot of confusion, I think, among people about the differences between what's called CBD and what's called hemp and what's called full spectrum. And um, legally, CBD as just a single isolate is classified by the FDA as a drug, and that drug is called Epidiolex. It's used in children with seizures, and so when CBD was presented to the FDA for approval as Epidiolex, that becomes a drug. So there's kind of a misnomer in the products on the market. There are hundreds, if not thousands, of CBD and hemp oil products on the market. So I always tell my owners, you really have to watch out for the quality of those because there's so many of them. A lot of them, there was a study done, a lot of those don't even contain the amount that they say they have on there. Some of them don't even have any cannabinoids in them at all. So
Mhm.
technically, CBD as an isolate is extremely expensive. So most of the products that are labeled CBD as a pet supplement are going to have other cannabinoids in there. So the hemp oil is, there are many good hemp oil products on the market, but as I said, Standard Process has what I consider one of the best quality ones because of their rigorous testing that they do and their goal of having organic products so that there's no risk of contamination from heavy metals, and they do verify that what they say on the label is actually in the product. So it's a full spectrum hemp oil is going to give the endocannabinoid system everything it needs. So I tell people it's kind of like if you take a carrot and you just take one component out of the carrot, you're missing out on the rest of the nutrients. And so a good full spectrum hemp oil is going to have all of those other cannabinoids in it. There's over 113 cannabinoids, and why would you throw those out? Because all of them are going to contribute in some way or another to supporting the endocannabinoid system. And I think that's a challenge for veterinarians because we were never trained in school on the endocannabinoid system. And it is the largest neurotransmitting system in the body. So we're not trained or we're not taught any of that. And I even asked a recent graduate, because I graduated over 25 years ago, and I asked a recent graduate if they're even talking about the endocannabinoid system in school, and she said no. And so we're
Wow.
missing out as veterinarians on the training and the importance of this system in the body and how supporting it is going to really help all of the organs in the body. It's kind of like a conductor of a train. They're going to really impact a good functioning all of the systems. So, and the body makes its own cannabinoids. So they're called endocannabinoids. But what we do with hemp and some of the other phytocannabinoids is we're helping supplement the body's ability to use that system to the optimum. So it really is something that is depleted in patients who are under stress or dealing with any type of disease process. Their bodies can't produce enough to really help that system function to its optimum. So I think that's the importance of understanding that hemp oil can be used to support the body in ways that it's going to help it to respond better to the stresses of diseases. So, it's been used in pain, osteoarthritis. Our study was on osteoarthritis, but also for seizures. So I have used it in a lot of my patients who are not well controlled on anticonvulsants. And so I add in hemp oil, and that gives the body the nutrients it needs to help stabilize and bring everything into homeostasis. It's also great for behavior anxiety cases. A lot of studies are being done for dermatitis and for cancer. So fortunately now there are a lot of studies being done to support the value of using a full spectrum hemp oil in your patients. So I think that's helping kind of educate veterinarians so that they feel comfortable using this in their patients.
Yeah, that was going to be one of my questions. So I know that, as you said, the study that you did was with dogs with osteoarthritis. I also know that you are a cat person. So I wanted to ask a little bit more about how you're currently using hemp oil in your own practice, with what kind of animals, with what kind of ailments, and what kind of results are you seeing?
Yeah, cats are cats, I always say, and they don't always like the taste of things. So if we can get them to take the hemp oil, and some of them will, because once again, it's plant based, and so most cats don't mind the taste of plants like maybe we would. And so the area that I really love using it in my cat patients is for those occasional cats who have seizures. Seizures in cats is not that common. When I went to school, we were kind of taught, oh gosh, don't use phenobarb in your seizure in cats. We don't really have enough studies to support, its impact. And so when I first started using hemp oil, I reached for that in my cat patients. And I will say that I have cats who no longer have seizures and they continue on the hemp oil. So I really believe there's such a great use for it also with cats with osteoarthritis. The things with kitties is that they develop arthritis, as early as 7 years of age. And we don't really see that because they're so good at hiding their symptoms. And so anytime you have pain in the lumbar area, it makes cats cranky, it makes them unhappy, it makes them not very tolerant of the youngsters who want to wrestle and tumble. So that helps. So a lot of times what we see as behavior changes can actually be that we're taking care of the pain that owners don't see. So they don't really exhibit pain the same way as dogs do. So cats are special. I love cats. It's one of my passions. And so I find hemp oil to be a really good addition to helping them just to cope with the world in a better way.
So how are you giving your hemp oil? Say you've got an older cat who you suspect is in some just geriatric pain. How are you giving that oil to them? Mornings, evenings, twice a day, once a day, with food, without?
Yeah, so once again with cats, that's one of the standard process has it in two different forms. They have an oil, they also have a gel cap. So I like the oil form better because you can kind of titrate it to the appropriate dose that you need for your patient based on their weight. I recommend giving it twice a day. Sometimes the labels are, in my opinion, a little bit on the lower end. So you kind of have to find what works. So I usually will start. It depends on the situation. You can go anywhere from a half a milligram per kilogram twice a day up to maybe 2 or 2.5. I usually like to start out maybe around, in the middle range and then kind of go up or down depending on the results I see. One of the challenges I find in practice is that a lot of owners will say, oh, I tried CBD and it didn't do any good. And because of the wide range of quality of products on the market, I tell owners that, hey, let's try one that I can stand behind with the quality of the product. And quite frequently, though, all of the labels, in my opinion, are way underdosed. And so they're just giving a little skosh, and then it's not really supporting the system as much as we want it to. So I have a tendency to go higher than what the dosage is on the labels.
Yeah, and I know myself, I have two cats quite close in age and quite close in size, but the way that they respond to just the exact same CBD oil is dramatically different.
Yeah.
So the dosage that I use between them is really quite different. And like even when I use it and why I use it is also very different.
Yeah, which is excellent example that, every patient is an individual. So we really have to look at the patient to see how are they responding? What are the potential side effects in cats? It might be a little bit of vomiting or GI upset, depending on the cat. But I find usually that you could mix it in a little bit of wet food, find something tasty. So that's why I do like the oil. So giving it twice a day, with their food, or if some cats are crazy enough, standard process supplements they make in some of the other areas, I would give my cat as a treat and they would eat it. And I'm shocked that a cat would eat this tablet. But once again, it's a bunch of plants. So some cats will take these things, as treats. And so it just depends. I mean, cats are cats, as I say, and that's why I love them dearly, because everyone is an individual. And so we do have to treat them as individuals and do what works for them.
I absolutely agree with that. I have three very unique cats, and the random force staying with me at any given time. So
Yeah.
I've definitely seen that myself. Um, so going back to the study that you did, your passion for the results is incredible. If you were to have unlimited time and unlimited funding to do another study right now with some aspect of hemp or cannabis in general, what do you think you would want to study?
Well, so that's an interesting question, because actually, when we did this study, we measured omega levels in these patients. And the reason that that's important is that omegas are precursors to help support the endocannabinoid system in the body. So our thought was, and it would have been a nice follow-up study, is to take those patients who had low omega levels in their bloodstream during the study and actually supplement them with omega 3s to bring that into a good normal level, and then see how they respond to the hemp. So to me, that would be a study. We had talked about, like, hey, we could do a follow-up study using the same patients, because I think what's important is every patient responds differently. So they were their own controls in this study. So that particular dog, we knew how that dog was on hemp oil and how they were on the placebo. So taking those patients to say, let's get their omega levels up and then see how they responded to the hemp oil. Did we get a better response? So I think there's those kind of layers that are there as far as research goes, is to see what the impact of adding in other nutritional supplements may help the body to respond better to the hemp oil that you're giving them.
Yeah, and this really checks out with everything that you've said so far in this interview, and the fact that you like to blend traditional medicine with more integrative techniques like acupuncture. You also mentioned in your CV and on your bios that you're very into nutrition. And
Yeah.
when I hear nutrition, I think the food, right? Is this
Yes.
good food that we give our pet or not? But to me, it sounds like you're kind of taking it one step further past those macronutrients into those micronutrients, and you're adding that as part of your integrative veterinary practice. Is that correct?
Yes, and I think diet is so important. And in my world, food is medicine. So I think it's an area also, talking about veterinarians, and whenever I see a second opinion for a nutritional consult, is I said, in defense of veterinarians, we are really not trained in nutrition. And so it's become a passion of mine just by accident. If you had told me when I graduated from vet school that I would be interested in nutrition, I would have said, "Oh, no way in hell would I do that." It's just not that interesting of a topic. But as time went on, and I happened to observe in my patients that wasn't getting results from them, for instance, like an obese cat, and I was using the standard big name diets that put the cat on a diet, and they weren't losing weight. And what I discovered was it was because the diet was inappropriate. And once I realized what cats should be eating is not high carb processed kibble. And so I started really focusing on that. And boy, once you start to feed them what really their body needs, then you get those results. So I learned rather quickly when I joined the practice that I currently own. I learned rather quickly the difference that diet makes. And so it became a passion, because most veterinarians don't really appreciate the impact that good nutrition has. So I was getting much better results with my patients than I ever had when I worked strictly at a conventional practice who sold those big name diets over the counter. So it's a real so the more I do this, the more I realize the impact things like omega 3s have on the body. And so it's become a little bit more exciting. So I'm getting more into the science part of it that I never thought I would. It's like I just want my patients to get better, but understanding why certain things will help them get better really gives me that spark to be more passionate about it. So sometimes I feel like I'm swimming against the stream, because I have very non-conventional perspective, but it's from the experience that I've learned over the years of doing it the conventional way and seeing the difference in my patients when I integrate some of the things that make much more sense to me now than they did 20 years ago.
Mhm. No, it's so interesting. I do have to say, like, I wonder if also this very wide worldview of veterinary care that you have, I wonder if it's also related to the fact that you came to the field a little bit later than some other people. There's a certain element of not fully formed frontal lobe going on with our 20-year-old
Yeah.
veterinarians, and you were fully formed by the time you came in there. And I think maybe in that regard, you were able to stand on some different concepts that like a younger person wouldn't necessarily have garnered by that time. Yeah, so I can understand why your viewpoint would be unique really from the foundational aspect of your learning journey. I have a story that I haven't really told anybody yet, and I think it might be slightly controversial. I've always been someone who walked my cats. I wasn't really supportive of cats being allowed to roam. That was just my personal bias. And then I moved to a very rural area of Ireland, and I got my cats a GPS tracker, and now they're allowed to roam for a couple hours in the morning and a couple hours in the evening. And what happens is they eat a lot of mice. And at the beginning, I've always been quite conscious about what I feed them. At the beginning, I was like, oh no, they're going to gain a ton of weight because I don't always see them eat the mice. If I do, I let them do it anyway. But I'm grateful for that. But the so shocking thing to me, I have decreased their intake at home by a little bit, but not much. And actually, one of my cats, I've increased her intake because she's getting so much exercise that she's like lost a ton of weight. Even though I've seen her eat mice, I know she's doing it. What I've noticed is their muscle mass has very much increased. You can see it, you can feel it, and when they move, you can see it as well. And they have not gained any weight.
Mhm.
And where I live is rather unpolluted, I would say. Watching my cats eat the raw meat, bones and all, and watching what's happened to their bodies and their attitude and yeah, just their like overall fitness is just, it's been incredible. So I'm definitely a convert as far as, it's not about less food, it's about better food. And I'm actually now very grateful for this mice supplement that they have been eating.
So kudos to you because they are actually eating the most appropriate diet. And that's the thing that people don't understand is that cats are carnivore by nature. They need protein. So the ideal, and I tell this to people all the time, the ideal diet for a cat is a mouse. I said, if there's some way we could think about canning just mice and feeding that to cats, it would be awesome.
Oh my
But
gosh. It's the funniest thing too, because I've become so desensitized. I was never really freaked out by mice anyway, but I have become so desensitized to dead mice around
yeah.
mice. And I would totally feed a canned. I mean, people give snakes mice.
Oh yeah. So the good part about that is that you mentioned your cats are very lean, and that is because they're eating an appropriate diet because what they need is protein. The problem with obese cats is the processed kibbles are very high in carbohydrates. So as I explained to people is that in their most nutritionally best compact meal would be a mouse. The only grains they would get would be what's already digested in the stomach of the mouse. And so it's pre-digested. So that's not something their body needs anyway. So it's just a waste product. So a mouse is actually has all the nutrients you need, bones, organ meat, muscle meat. And that's what gives cats that ability to have a good, healthy, lean body condition with good, as you said, musculature. So ideal food. So you're fortunately in an area where that is a appropriate lifestyle for your cats. Your cats will be very healthy. They'll live to be very, very good, ripe old ages. And I that's one of the topics that I struggle with is when cats develop kidney disease. A lot of veterinarians want to put them on these overprocessed, what they call kidney diets. And in reality, you're cutting back what they need the most, which is good protein, good quality protein. So I see cats who have much better muscle mass at older ages if they're eating appropriate diets. I think so many times we just feel like, oh, it's an old cat, so she's skinny and she doesn't have much muscle, but that's age. It doesn't have to be that way. So your cats, when they get older, are going to look like they're 10 years younger. So uh, kudos to you. Your cats are very lucky that they're eating a really good diet. So
Yeah, no, it's been really fun to watch. And I gotta say, like, cats are entertaining no matter what, but watching a cat chase a mouse is, you
yeah,
feel really bad for the mouse. Feel pretty bad for the mouse, but it's pretty entertaining. Yeah.
yeah.
So it's interesting to me as I hear you talk about all of this. One of the things at the Veterinary Cannabis Society that we so often hear is that veterinarians started treating their own personal ailments with cannabis and hemp. And then they thought, hey, if this works for me, it probably worked for my pet. But kind of the way you talk about it, I wonder if it might have been the opposite for you.
It was the opposite for me. And so I actually started seeing the results in my patients. And then I decided, you know what, I should try this. So it was the opposite for me. So I have a tendency to like feel like this is a good idea, and I'm more focused on what's right for my patients. And I've kind of put myself as second. So it's like it's an easy move for me to say, oh, this would be really good for this animal. And then I realize I should be doing it for myself. And so I sometimes kind of like I fall behind. One of the interesting comments about that is that I feel very strongly about getting grains out of the diet of both dogs and cats because grains are very pro-inflammatory. So I've been pushing that for many, many, many years. And then I decided in my own diet, I'm like, maybe I should cut out grains. It's amazing how much decreased inflammation. I don't have pain in my knees. I don't have pain in my hips. And so I realized that what I've been preaching, I should be doing for myself. And I actually can testify that it makes a huge difference in decreasing inflammation in the body. So now when I do my spiel, I do mention that, hey, and I've done it for myself. So anyone who feels like I can do this, although it's very hard because I love bread, as we some of us do, pastries and bread. But if I cut that out for any certain period of time, I feel so much better. So yeah, it's been the opposite for me. I usually
Yeah.
what I see in my patients, I'm like, maybe I should do this too.
Yeah, it's really fun. No, it is. You're such an interesting person to talk to just because of the way that you entered veterinary medicine and where that journey has taken you. And I think you're also a testament to the indisputability of science.
Yeah.
And whether it's qualitative, quantitative, anecdotal, clinical, I think you've seen all of it. And that does make me want to ask you, in your own practice, it's Mariposa, right?
Mariposa.
Veterinary Wellness Center. That's it.
Yes.
Do you have any like star stories of an animal that came in with a pretty dire outlook? And if what your integrative blend was, particularly if you used hemp oil in that nutrition to bring that pet to a better outcome or a better prognosis?
Yeah, actually, I have several, but one of the ones that stands out the most was that after hours, several years ago, a person who was not a regular client reached out to me and was distraught because her dog was diagnosed with end stage kidney disease. The dog's BUN and creatinine were very, very high. The veterinarian said, you need to euthanize him. And the owner was in tears. She said, I'm not ready to. I just can't do it. So I had her come to the clinic and did an evaluation. And yes, he had very high kidney values. He was eating, in my opinion, very poor quality food. He was dehydrated. So I told her, I said, okay, here's what we're going to do is let's rehydrate him. Let's change his diet to something that's going to give his body what it needs to function. And I started him on the standard process renal support for dogs. And it's, once again, whole food supplement. I really believe in the power of food, and it's nutritionally supportive of kidney function. And so I'm like, let's, at the point that you see elevated kidney enzymes, we know that 75% of the kidneys are no longer functioning. And so I really wanted to support. And I said, hey, let's just try this. So she went home. She felt a little bit encouraged. And I said, this is going to be a little bit of a process. So she made a food change. He started loving the food. His quality of life improved tremendously. And that's my goal. And I tell people that we can't chase numbers on a piece of paper. We need to look at our patient. We need to help them have an improved quality of life. So that dog just rebounded, was happy, was active. If you looked at him, you would never know that he was in end stage renal failure. He lived for 2 more years. Happy
Wow.
life, happy life. And she often said, I want to go back to my old vet and say, see here, you told me to euthanize him and look at how he looks. And he was my just kind of a symbol to me that you do what you can to support their body and let the body heal itself, function. And it's my job to make sure I give the body the tools it needs to perform better. And so that's kind of thinking outside the box. And I think part of my background of having a Bachelor of Fine Arts degree is that I'm using that other side of my brain. And so I have a tendency to be a little bit more creative, and I'm a very kind of analytical person. So I always look outside the box, like what makes sense to me to do. And so I think as veterinarians, we are so rigid in being taught our scientific perspective, is that sometimes you have to go outside that box and just think about how things function, and then look at the other options that would help support those functions to be optimal.
That's absolutely fantastic. I love it. I got little goosebumps when you told that story. So, this whole time I've just been thinking, Dr. Sheila, do you know about our other sponsor, Evermore Pet Food? It's a
There,
Veterinary Cannabis Society sponsor, excuse me.
there's so many good pet foods out there, but
Yeah.
that one's not familiar.
So I would be remiss not to mention Evermore Pet Food during this podcast. They are so fantastic. There's actually another podcast on the Veterinary Cannabis Society YouTube page where this one that we're doing right now is located as well. I feel so strongly that they have a fantastic line of nutrition. It was just for dogs, and now they've expanded to cats, which I'm so excited
Ooh.
about. So I would highly recommend you check them out. I'll also put links to that other podcast in the description below. I'm very curious to see what you think about their organization. And I'm kind of thinking maybe the Veterinary Cannabis Society should do a nutrition and cannabis coffee chat.
Oh, that would be awesome. And I love that there are better foods coming out there. There is constantly new foods that I'm looking at for my clients. I don't carry a lot of foods in my clinic because I want them to find the most appropriate food that fits within their budget and lifestyle. So I encourage them to go to the best that they can. And so I'm always loving to find new ones that I can recommend. So thanks for that. I will definitely look into them.
Yes, I'll follow up with you as well. The last question I have is also very personal. And as I mentioned to you before we began this podcast, I have my three cats, and then currently I'm fostering or babysitting my neighbor's cat. She is having a human baby, so I am
Oh.
taking care of her fur baby at this moment. And he already knew my cats from outside. He's really sweet, but one of my cats, it has been bullying him. And on your website, you mention she has a special fondness for helping owners struggling with inappropriate elimination issues with their cat. My question is, can I use hemp or cannabis to help with the inappropriate elimination issues? My bully cat is peeing all over the house, I think, because of the fourth cat. What do you say?
I would say yes, because once again, you're supporting the whole, behavior side of the endocannabinoid system. And so I would say yes, I would do it. Also, you have to understand the situation. When they're outside, it's a shared kind of territory. Now that cat's coming into your cat's territory. So they're responding very protectively. So that sounds to me like marking behavior. So what they're doing is, this is my territory, stay out. So outside, sure, they know the cat, but now the other cat's encroaching on their territory. So out of respect for your kitties, they have a right to protect their territory. But I do think that using hemp oil may be a very big help. So I would encourage you to increase the dosage that you're using and do it twice a day.
Okay. Yeah, I think because there's it's not that bad. There's glimmers, and it's only been 4 days, but there's
Yeah.
definitely glimmers. I feel like they could play together, and they're actually the two that are the closest in age. I think they would enjoy playing together. But right now there's some stuff going on. So
Yeah.
I'm grateful for your personalized
Yeah.
help to me today on this podcast.
Yeah.
I had to slide that one in. I will now go immediately and provide my cat some hemp oil right after this
Good.
podcast ends. So I'm so grateful for your time today. I have a feeling that the Veterinary Cannabis Society community will be seeing you in our online content again. I will link your wellness center, your veterinary wellness center, in the description below. I will link that study. The study is actually already on the Veterinary Cannabis Society website, I believe under in the news section, but I'll link that below because it was big news when it came out and we were so happy for you. Are there any other links that you'd like me to include or any other ways to contact you that you'd like the listeners to know?
No, I think you've got it covered. I really appreciate it, Emily. It's been a joy talking to you, and I'm always happy to support the Veterinary Cannabis Society in any way I can because I believe strongly in getting the word out and educating veterinarians is really going to be beneficial in this area.
Thank you so much.
Thank you.
The Veterinary Cannabis Society is grateful that you've entrusted us with your time and education. You can learn more about the topics covered in this podcast by reviewing the links in the description. Please like this video and subscribe to our channel so you can stay notified when new podcasts like this are released. Give us a comment below and let us know what you found most interesting. Finally, I'd like to thank our sponsors, Evermore Pet Food and Standard Process, for making podcasts like this possible. Your support means so much to us.